So tell us a little bit about your thoughts on the vaccines, I should say, now that there's multiple ones. Tell us your thoughts.
Sure. So we'll try to keep it brief. The vaccines are experimental. Potentially, they can do some good. I think again, the government and private interests, in order to get a emergency use authorization through the FDA, because most vaccines and meds take 4 to 10 years, and this one took 6 months. So it was on the turbo track by government and private industry to get out there, but at what cost? We don't have a lot of long-term safety data on it because it just wasn't available in that way. My thoughts on the vaccines are it's basically a huge experiment. The vaccines aren't for everybody. Everybody should consider risks and benefits whenever they consider any intervention, no matter what it is. And my thought is people over 70 had the highest risk, those in nursing homes, and those with 2 or more inflammatory conditions like rheumatoid arthritis or lupus or something else where you're taking steroids like lung conditions, asthma and COPD. Those would make you at higher risk. And these are the very people that would benefit most from the vaccine. Who would benefit the least and have the most risk? Kids. Kids shouldn't take this vaccine. And there are already legislators trying to force kids to have it. And frankly and honestly, it wasn't tested on those people, and it really shouldn't be tested on those people because kids are resilient. Any pediatrician will tell you, call me in the morning if there's a problem, and they seldom call you in the morning. That's just the way that goes. So parents can also tell you the same, that with your first kid, every pimple and skin change, you're paranoid as hell. And then like second, third, fourth kid, you're like, yeah, whatever. Let me know if the bleeding doesn't stop. So not to be cavalier with kids, but just to exercise some humor here, that kids are the safest population. So kids have a much higher risk of lifetime problems from an untested vaccine, in my opinion. Also, pregnant women shouldn't be on it because there's 2 people at risk then, not just the pregnant woman, but the developing child inside. And for me, there's very little benefit to normal, healthy, middle-aged folks who are doing most of the right things and don't have a lot of the problems. Now, assuming that the blood type thing gets fleshed out. But so everything has a risk and a benefit. And with this one, all the risks aren't known. So to go on what the TV news cable channel tells you probably isn't the best idea, or your governor necessarily. Unless your governor is a physician and they're your physician. And that's the most important part. Private physicians that are individual are invested in individual private patients. And that's the secret sauce that made medicine work for the last 100 years and unfortunately is being undone by government and third parties.